Good morning, everybody. Welcome to the Academy of Osteoporosis. This is the last 12th lecture. My name is Edward Czerwiński. I am Professor Emeritus of the Jagiellonian University and Senior Medical Director of FutureMed. I would like to discuss with you a falls problem, why we fall, can we prevent, and surely what is the practical and medical meaning of falls. Fall prevention, and I just liked to have 12. I thought, ask myself why 12 hours, 12 zodiac, 12 Jaguar Israel, 12 apostles, even 12 Chinese, and 12 as a dozen of the measurement. And it comes very simple from the observing the word, and we have the day, moon, month, week, 28 days, that the final lecture. Today, we're going to discuss the clinical significance of falls, causes of falls, sarcopenia, fall prevention, and eventually conclusion, surely. It is a huge problem, much underestimated. In the world, we have a billion of population. We have 200 falls worldwide with 33 millions of disability and 7 millions deaths. 40 deaths related to injury are related to falls. Here we have the data from US of 2021. We have 14 million fallers, 27 adult, more women 28, and men 26. 6,000 died. And we have for the population, therefore 80 men and 63 women. The number of falling individuals over years, here we have the average, and men have higher and women have lower frequency. Age dependence of falls and injured falls. In the red, we have prevalence in women. In blue, in men. And dotted, we have injured women. And here is the group of 65-74. We have 75-80 and over 80. And as we see, as we are aging, in women and men, we have increasing number of falls and also increasing of number of falls with injury. Falls-related death, also data from US 2023. And please take your consider. You have falls data and death related between Black, non-Hispanic, Asian, Hispanic, American, Indian, and white. It is the age 65-74. We have 21 per 10,000 of population. In 72-84, and over 65, we have 300, almost 400. So we have 40 times more falls, say, if we are getting older, and in this age group, whites predominant, unfortunately. So 1 year is woman, 1/3 woman, 1 of second men over 80, and 3 women falls, and 3 women for 3 times more that often that men. 37 falls generally required medical attention, and 20% of fracture and in hospitalization. The number are different for various study, and roughly we can say that from 5 to 10% of falls results in fracture. What is our discussion? That 100 fracture of forearm are due to falls, 90% of femur fracture, and only 1/4 of the vertebra fracture. What are the causes of falls? We are dividing risk of fall intrinsic, I mean due to health condition, and we have 400 evidence-based that's documented, like muscle weakness, balance disorders, gait disturbance, vision, mobility, cognitive function, and other. And we have environmental. Environmental means at home or outside the home. Environmental inside home are slippery surfaces, uneven sideways. At home, poor lighting, obstacles on the floor, slippery rugs, and lack of handrails in the bathroom. Usually, there are more than 3 causes of falls. 89% have 3 causes of falls. And only single one needs just one cause. Outdoors have 60% of falls, and they are more common in young people because they are more active, and are more common in men. And indoors, 46 falls, and more completed in elderly, and fracture of the proximal femur, 85 occurs at home, and 25 are caused by environmental factors. Why at home? Because elderly people have sedentary style of life, and they usually fall at home. And the majority of indoor factors are caused by internal falls. Here you see the outdoors falls, 67%, and some other places are in the smaller percentage. Hospital is very dangerous place for elderly people. 30 to 50 falls per year, and it is calculated at 1.5 falls per bed per year. And even changing the localization of patient in the new environment increases the falls of 50%. The outcome of falls is that the 40% of the home will be fractured, 40% ferro filling, and some more percentage of hospital admission, confusion, and other damage. Causes of falls and balance system and muscle wear. So, definition of fall. Fall is an unintentional event that results in the person coming to the rest of the ground or another level. Unintentional event. Did you ever thought, why don't we fall driving a bike? If you leave the bike, it will fall down immediately. And we are teaching our kids how to drive the bike unless they do it themselves. Everything is based on the stepping response, and the fall occurs when the gravity center projection will be beyond the base of support. So here is the balance. It is the center of gravity. It is the base support. And if we move, so our projection of center gravity is beyond the base of support, so this is the fall. In my case, my center of gravity is on L2, means here, 100 centimeter, And if I just burn to the left, I will fall, definitely. But due to steeping response, I will move, and I will have a new base support, which will support the extends beyond the base. And this is the answer why, and this is why we don't fall staying even on one hand. And this is the movie, how it works. Stepping response. How the mechanism of balance work. We have Jordan Lynn. She stands just on her tiptoes, and she controls where she is to her eyes. Eyes is informing our brain, and this is our balance system in the air. And as we know what is our head, we know what is our body. We are giving the information from the position of our joints, and we respond to the change. That's how it works. How we keep balance, even having so small quadruple basis, so small quadruple basis, but the final response is the fit muscle who will move the body to the new position. And when you have your aging, we have energy depletion, shortening telomere, metabolic wasted, free radicals, and our engine is also getting older. So we have less energy, and the system goes from the brain to spinal cord, peripheral nerve, and to synapse, and then go to the muscle. If we are getting older, so everything is slower. Our eyes are worse. Our brain works slowly. Our muscles are weak, and the response to the stimulus will be also smaller. So unfortunately, she will not, but if you or you will fall because aging and frailty. And we come to the sarcopenia, and the first four risks are three main: is the muscle strength, the internal and internal factors, which I talked before. The definition of sarcopenia is from Greek. Sark is muscle, penia means loss. It is a syndrome characterized by progressive and generalized loss of skeletal muscle with the risk of adverse outcomes such as physical disability, poor quality of life, and even death. The diagnostic criteria is low muscle mass, muscle function, mean strength and speed. And definitely there is a absolute difference between measuring the bone, where is endurance of the bone, and the bigger bone mass means the higher resistance to fracture. The response the muscle works is the flexion. No, the muscle is the twitch. So the speed of muscle and the muscle strength and speed is the major factor for muscle quality. So here is the normal muscle in MRI, 20 years old, and here are 66 years old. Or muscle, there is a process and here 80, and here you have 80. You see that you have less muscle and more fat. So the less muscle is slowly weakening. This is the big muscle, and you see Ed Wycock, who ran marathon when he was 74, have no big muscle as this lady, but he is very fit to even to marathons. No muscle mass, but muscle function, speed, and power. We have some methods to measuring muscle mass as muscle quality as well. So MRI is definitely the best, have a fast solution. And here you have the results in 26 and 87 women. CT2, but there are both quite expensive. There is CT. Very common, even in bathroom weights, are bioimpedance method, which just measure the resistance of electricity, and bioresistance of water. That means muscle is 80% muscle transduct the electricity, and fat only 20. So we can just measure the speed and calculate how much is for much water is. Water means muscle. It's quite invasive and really we have in bathroom weights, but the more reliable are we got for limbs. Bone densitometry do it perfectly, have low cost, widely available, very sensible. It doesn't give muscle quality, but none of them give. And here is the DEXA. We talk the same machine, of course. We have so-called total body. Here we are. Here we have a measurement of the women, the appendicular lean, what means majority is due to muscle. And if you calculate that, the skeletal muscle mass is 55 kilograms, her height is 1.75. So standardized muscle mass is 7.2. So she has sarcopenia. How we measure muscle function, muscle speed? Very standard is test up and go. So we have a watch, and she is sitting, stands up, walks 3 meters and back. Average is 10 to 40 seconds. Muscle group is very cheap. I advise you to buy some. And it is just measure the power. That's me, my assistant. Normal for women is 20, and for men is 30 kilograms. So we are in good shape. Now there are strong relationship between sarcopenia and osteoporosis. Here is a study of 300 women, age 79, after 21 days after the fracture, and they did the bone density measure and the sarcopenia measurement, and they found that 74% osteoporosis, but within that group, 58, the majority had the sarcopenia, so, and 40 have sarcopenia and osteoporosis, so only 28 was without sarcopenia. So more than half of the women with fracture of the femur already have sarcopenia. Consequences of sarcopenia: slower muscle, slower strength and slower speed, increase of falling, of fracture, disability, and risk of death. So sarcopenia and fracture. Here are the coefficient of force and fracture, and it's going to fracture. And you see weakening of the muscle is 4 times equivalent, prevalent force 3 times, gait disturbance 2.9, and balance 2.9. So all of them are related to sarcopenia. There was a prospective study, 2 years observation, 260 participants, and force was 27% is sarcopenia, and only 9.2% on sarcopenia free. Here is the current 25th meta-analysis for risk on 10,000 of participants, fractures of for risk of 10,000, fractures 28, hospitalization, and what they found that in sarcopenia we have evidence of increased risk of falls, evidence of risk of fracture, and evidence of risk of mortality. 2+ means very high, and all of them are very high mean meta-analysis, longitudinal study, and cross-section study. Sarcopenia and proximal femur fracture and DEXA measurement. One group is without fracture, and the second is with the fracture. And if we have here with no fracture, the level of sarcopenia is 58%, and with fracture, please note that in men, we have 80% of sarcopenia, in women 40%. So sarcopenia is even more related to fracture in men than in women. Sarcopenia and risk of death, 900 participants, 5-year observation. Here we have the green is highest, the bronze is medium, and the rest the lowest. And we see the correlation between respiratory diseases, circulatory, and total. And what they found, and if we compare with the higher and the low, that means the weak, the lowest hand grip again to the highest indicate the risk of death 3 times. That means you have hand over somebody dynamometer, check, and you can say you have very small risk of death, or the risk is 3 times higher than, say, somebody who have good muscle. Sarcopenia and possible treatment. In fact, only exercise and vitamin D and diet have some effect, but there are many pharmacotherapy, hormone therapy, testosterone, some anti-myosin as well. So, in fact, exercise, vitamin, and diet are proven that they are still developing. How to eliminate? We have elimination of healthy risk, inner risk. So it is. So we have many of them: vision, cataracts, other circulatory arrhythmias, failure, peripheral, pacemaker, nervous, dementia, dizziness, mental depression, and eliminating of health risk is always difficult. Sometimes we can do many against. Medication that increases fall, you see benzodiazepines, antidepressant, psychoactive medication, antihypertensive, cardiac painkillers, majority of them, and taking more than 4 increases the fall risk 6-fold. Elimination of environmental risk, it is pretty easy. Footwear, anti-slip mat, hip pads, lights, alarm, bathroom, canes, low beds, public transportation, education, treatment modification, training, exercises, and rehabilitation. I am always asking my patient whether they hold the handle in the bathroom, and majority have no. Stairs, lightning at night, and obstacles. If I have a lady with a very low bone mass, say in the hip -3, I am starting my talk. Hey, you are this of falling. Let's check whether you have some traps at home. Do you have handles? Do you have lights? And so on. This is the first thing I am talking to lady. Then I talk about the vitamin D, then about the medication and the whole this stuff. Falls at home. And can how effective is preventing, that means eliminating of environmental factors. There is a single study, 300 participants, 75 of age, 3 years follow-up, and reduction was 38%. Meta-analysis, if the average 3,000 of patients, a reduction 21% is average population, and about 40 in those who were at high risk of falling. And here you see the false meta-analysis. Definitely, there is a to the intervention, and we see that there is significant difference. At the winter time, I always asking patients whether they know the ice cleats or anti-slip covers. It means you can buy it in the internet. It costs, say, $5 or less. I can tell you almost every patient have no idea, and they are very happy if I show them the first visit in my patient. And how it is, you just take one and you just put on your shoe, and you have just irons under now, and you are walk safety. Every patient should have that information. Ice distribution cliff in Sweden recently, they have 73 treatment municipalities and 200 control, and they found reduction of ice injury 24%, and 38 they distributed more ice cleats. So they are very effective, and the more you are given, the best. 38 is really a big number, just showing people the ice cleats. And another effectiveness of unsupported home-based exercises, and it is our TIGO control, 600 participants, 73 years, and 12 months. They have 70 different exercises at home, but unfortunately, not much, there's no difference in fact. There's been intervention and exercises, no difference. There is another study, that means there are 67 participants, 73 years old, intervention group 300, control 12 months, and they found 50% reduction of fear of falling, and fear of falling is the risk factor of the further fall, and 46 improvement of gait speed. Here is the how done by my assistant. I will show you a few minutes, and the whole you can find on our osteoporosis, www.osteoporosis.pl. A few seconds of that video. Exercise extending knee with hands raised up. And the second is quite more difficult, tandem walking. And we see that this woman is supporting herself on the table. And the effective exercises for prevention in the community is a bigger study, 900 women, 76 years old, and they have just gym and Tai Chi, and they fall 40% reduce of falls rate, 30% of falls needs medical consultation, and 30 or 38% reduction of fracture. So that's really important. And here we have the results. Control group falls. Here is 26 for with prevention, and so the injuries after falling, and here how it looks in the days. The best method for improving stability and for prevention is Tai Chi. It is well documented for over last, I think, 30 years. And here is the meta-analysis, 70 trials, 300 participants, and here how reduction falls even half. So let's watch the movie. You can also find it on our page, Osteoporosis PL。
学中，凡是与一二段太极拳相同的动作，其要点也相同。下面请看完整示范。
You have the biggest analysis, meta-analysis of intervention for preventing elderly adults for 41,000 patients, meta-analysis, 280 randomized control trials, average 78, observation varies from 6 to 12 months, and there were 39 different interventions. And here you have many of them, and here you have visual and environmental, here you have exercises only. So the more intervention you put, the higher outcome you can expect. And here is the comparison of the falls, and in this study, and here is the when there were question, geriatric, vitamin D, exercise only, exercise environmental, some exercise. So exercise gives something. If you have vision environment is much better, and exercise plus vision and comprehensive study, the output is absolutely the best. So we came to the summary. So 1 in 3 women over age of 65 falls, 25 falls roughly results in injury, and 11 required hospitalization. If 5 to 10 falls results in fracture, and remember that almost every non-vertebral fracture results from a fall. In States, falls account for 38,000 of deaths, and mortality increases with age, especially in white, unfortunately. Compared to the hard population, the mortality increases almost 8 times in the group 65 to 74, 40 times in the group 75, and almost 20 times higher in the group about 85, 20 times higher. So that's this something we have to think about. Falls are caused by a variety of internal and environmental factors. Most falls result from 3 or more coexisting factors. Sarcopenia coexists with osteoporosis, increases the fall risk and mortality. Reduced functionality of muscle system plays a central role in delayed protective response to falls that leads to increased susceptibility to falls and of falls-associated injuries. By eliminating environmental factors, however, we can reduce falls up to 40%. Eliminating the influence of internal factors on falls occurring is challenging, and it roughly depends from if we can treat the diseases such causing the fall, means circulatory insufficiency or vertigo. Performing isolated exercises at home has proven ineffective in fall preventing. However, the inclusion of Tai Chi practice yielded remarkable results. Since falls result from interaction of multiple internal and external factors, the most effective prevention can be expected through a multifunctional intervention. I'd like to thank everyone for attention, and I appreciate your comments, question. Although this is the last lecture in this series, I will continue presentations on web, so please on the Vimedi, YouTube, and Instagram. Surely you can watch me also on Facebook and LinkedIn. Please subscribe to my channels and share them with the colleagues. Your likes will be greatly appreciated, surely. I warmly invite you to explore Polish portal Osteoporosis, which in fact is in Polish, but you have instant direct translation to English, and there is my L as well. As a gift for you, I prepare a special presentation, Osteoporosis Academy photo gallery, and I include all my photographs used during these lectures. So thanks again, and see you soon. And bye for now. Good luck.